Hi, this is Dr. Dean Visness, and we're talking today about Evenup, a new product from Colorescience. Before we start talking about Evenup itself, I'd like to take a moment to ask you to reconsider how you think about Colorescience, not so much as a makeup company, but more as a skincare company. And the reason behind this is that Colorescience has really gone to a great deal of effort to redefine themselves as a company. They're really a company that's built on a foundation of science and has a very strong history with Skin Medica, a company that we're all aware of, and the science behind their products. So Mary Fisher, who is the CEO of Colorescience, was actually the former CEO of Skin Medica and responsible in large part for the growth and success of that company up to its acquisition by Allergan. And the way they have sort of rebranded themselves or redefined themselves is as a company producing skincare products that are really a fusion of skincare, sun protection, and color correction. So the goal at Colorescience was to develop a new skincare product that would address one of the top skincare concerns that patients have today, which is pigmentation or hyperpigmentation. And that's a very common problem, as we're all aware, in both men and women of all ages. So what we know is that over 30 million Americans suffer from pigmentation of some form or another. Over 80% of women don't leave the house before applying makeup, and in our demographic, that percentage of women is probably actually even higher. Physicians believe that SPF is the most important element in treating and preventing hyperpigmentation. The American Academy of Dermatology recommends a minimum of an SPF 30 in skincare products on a daily basis. And if you're lucky, some of the skincare products you would apply on a regular daily basis in makeup, etc., are SPF 20, if that. And then consumers really want a beauty routine with multitasking products. The skincare regimens these days are sometimes becoming so multi-step and complex that it takes numerous products, and consumers would really like skincare products that perform multiple tasks all in one product. So what Colorescience has done is come up with a product that they call Evenup, which really embodies a lot of these different multitasking ideas or things to kind of roll multiple tasks all up into one product, as we'll see. So Evenup is the skincare product that really brightens, corrects, and protects in one. It brightens with Lumira, which is a skin brightening complex we'll talk about. It has color correction to instantly reduce the appearance of redness and hyperpigmentation. And then it protects with SPF 50. So over 94% of patients after 12 weeks saw an improvement in age spots and pigmentation. 96% of patients saw an improvement in skin tone evenness after 12 weeks use. So it's a very interesting product, and we're going to go over it in a little more detail now. So what it is, it's a multitasking product that uses a number of different ingredients that work as skin brighteners. It has SPF 50 physical sunscreen in it, and it also gives you cosmetic coverage or cosmetic primer baseline coverage. The skin brightener is Lumira, which is really a combination of 4 different ingredients, and that is the ingredient or product that really minimizes hyperpigmentation over time. So it's not just covering up pigmentation and redness, but it actually has ingredients that will reduce your own skin's pigmentation over time with continuous use. Vital ET, it's an active form of vitamin E. It's a potent antioxidant. It reduces inflammation, redness, erythema, acne, and it inhibits melanocyte activation. So Evenup is actually something that can help with acne over time and is good for patients with acne. The Venusian also reduces inflammation from acne and other things. It blocks UV rays, and it inhibits melanocyte activation. Revinage is a well-known potent antioxidant that inhibits tyrosinase, another enzyme involved in the production of melanin. And then Unilucent PA13 also inhibits tyrosinase and reduces melanin production along a second pathway, and it also blocks melanin transport to the keratinocytes. So it's these four ingredients in their active ingredient that really are responsible for reducing hyperpigmentation over time, similar to something like a hydroquinone product or a Lytira type product. It has SPF 50 in it, a physical sunscreen. It's a broad spectrum SPF 50 that's mineral based. It has zinc and titanium in it. It's water resistant for 40 minutes. So not only when you put this on every morning are you getting instant coverage, color correction, but you're also getting SPF 50 for your daily sun protection, which is pretty great. And then you have your cosmetic color correction. It's a treatment primer basically. It diffuses and corrects hyperpigmentation and inflammation, so it reduces visible redness, erythema, pigmentation, and it also minimizes the appearance of pore size. So you're getting some of your basic foundation coverage here, but you're also getting SPF 50 and you're actually getting your active skincare products that reduce pigmentation over time. So the clinical studies show that after 12 weeks of use, 94 to 96% of patients saw a significant improvement in the appearance of age spots and pigmentation and the overall appearance of skin tone. Pretty impressive, 94 to 96% after just 12 weeks of use. Key concepts in the application in Evenup. These are two of the most important concepts to make sure that patients get a good outcome in the use of the product. If it's not used properly, like a lot of products, patients won't be happy. And the most common complaint would be that it's too heavy or too cakey, and this is almost always from improper application and use. So the two key things, remember, a little bit goes a long way. Some patients with smaller faces may only need half a pump in order to get complete coverage. So start low and work your way up. And it's essential to apply a hydrator or a moisturizer to the skin first. Otherwise, you can get a sort of a cakey, flaky appearance. So if we look at this quick video on the application of Evenup, the key points that you want to remember, you want to put on a hydrator or a moisturizer first. You want to put that on over the entire face, down onto the neck, wherever you're going to apply the product. You can use something like a B5 hydrating gel, or you can use the new H5 hyaluronic acid product, or you can use more of a cream-based moisturizer, but you want to put that on the face and smooth it into the skin, work it in like you normally would, and then allow that product to dry so it's not tacky or sticky wet when you put on the Evenup on top of it. That only takes a minute or so. When you put the Evenup out onto your fingers, remember a little goes a long way. You want to warm it up in your fingertips because it's a mineral-based product, and the heat from your fingers will actually soften it and allow it to go on more evenly and uniformly. Start by applying it to the areas that are of most concern to the patient. If that's the cheek and the forehead areas or the nose, start by applying the product there and then feather out to the periphery and the edges and down onto the neck and the jawline. And then work it into the skin until you get a nice, even, uniform coverage as seen here. Once you've applied the Evenup, which is basically a color correction, it's diffusing the pigmentation and the erythema. If you want color correction, color matching for the skin tones, you can use a powder on top of that depending on the skin tone of the patient. So remember, Evenup's not designed to color match the skin tone, it's designed to mask the inflammation and the hyperpigmentation short term, as well as the other benefits. But if you're looking for color matching on top of that, you may want to apply a brush type of powder for that purpose. So uses and indications. I honestly think that at Skin Spirit, after nearly every aesthetic face treatment, whether it's fillers, neurotoxins, lasers, facials, peels, dermaplaning, anything, I think this is the perfect product to put on everybody, not only because of the coverage and reducing the erythema, redness, pigmentation, but you also get the SPF 50 and the active ingredients. And it's a great opportunity to educate patients on how this product really takes the place of at least 3 different products that they might normally be using at home and is probably better. So I think it's a great product for patients to use at home every day on a regular basis for SPF 50, color correction, and then addressing pigmentation and erythema over the long run. I think it's a fantastic product for men because it's not makeup, yet it covers a lot of the redness and pigmentation that men have, and it corrects and protects all in one. So if it's presented as an active skincare ingredient, not a makeup product, I think men will be much more likely to use this on a regular basis. So I hope you have a good understanding of what this product is now, how it's different, how it's extremely unique, and how I think it's applicable to a lot of patients in a lot of different areas. Thank you.